I just love ice so much. What's up, you guys? It's Jessie back again with another new video. If you're new here, hi. How are you? I don't know why I have this air of feeling like I have to be completely professional in all of my videos when literally my goal is to be as real as possible and to be as much me as possible. So professionalism, I'm just here to have a good time and teach new things. If you're new here, hi. My name is Genesis Ventura. My credentials are RDMS for those of you who are coming in for your sonography desires. But you can call me Jessie. So that's Jessie with the G, drop the E. I have a confession to make. This is not the original video I was going to put out, nor is it on time. I think that's obvious at this point. So the video that I had originally recorded and had scheduled for Friday ended up with half of its film deleted when I went to go edit it. It was a sad, sad time. But we are faithful warriors of God, and we know that everything happens for a reason, and we know to just trust God in the process and just start over again like nothing happened. Now, when I was sitting down trying to figure out how I was going to get a video on time, because I really wanted to get a video out on Friday, didn't happen, but what can we do? I considered doing either a get ready with me or a story time video, something short to just kind of fill in for Friday. And I was originally gonna do kind of like a get ready with me story time thing, but then eventually I decided to just do kind of like a sit down, do my makeup while talking about what I was originally going to talk about. And so that's what I decided to do, mainly because when I'm just sitting down here talking like I am now, I sort of kind of get distracted and then I tend to forget what I was gonna say. And also I like to talk with my hands, which is like I do in like most of my videos. And I decided like, why don't I just have something to do while talking about what I was gonna talk about, so it keeps my mind focused on something and then my hands can be doing something. And also because I've been seeing that kind of a trend like people want to see on YouTube is like people getting ready or like doing their makeup or doing some kind of unboxing or something while they're talking. And I don't know, it's just something like satisfying just watching somebody transform. So if you're intrigued by watching me slowly turn from Squidward tentacles to perhaps handsome Squidward, then that is something that I am willing to do because it helps me out and it'll give you guys something to watch other than my face. Well, you'll be watching my face, but watching my face not be my face. So that's what's gonna happen. Now the next clip is gonna be, you know, me not looking so put together. And this is just a warning. So be prepared. Don't be scared. Because the Jessie you're about to see doesn't have so much flair. But yeah, this is a warning. I'm not going to be looking too straight. I warned you. All right. So let's get into the video. All right, let's see if I don't absolutely end up hating this idea. Damn, my forehead really that big. All right, so here's my face all naked and prepped. So I guess I'm just gonna start off doing my routine and I guess explaining what I'm doing. Maybe not. I don't know. I don't know how to do this. I'll just do it the way I know how. Okay, so while I start prep, I'm going to talk about the first difference between a hospital and clinical setting, and probably the most obvious is going to be scheduling. So scheduling in a hospital, depending on what position you're looking towards or what they're offering you, you can expect to see anywhere from day shifts to night shifts, maybe overnight shifts, call, per diem, whatever the hospital kind of has to offer, because the hospital is like a 24/7 never-ending type of deal, especially if it's mainly an ER. And it also depends on if you're just working in the ER or if you also have inpatients and outpatients. If the place is a medical center, then you could be seeing all three, which could warrant different types of positions and different hours. Whereas in a clinic, you're kind of more used to seeing kind of like a 9 to 5, maybe 8 to 4, 7 to 3, just kind of like that 8-hour, maybe 9-hour, depending on how much lunch you get. Just kind of a Monday through Friday set schedule, no holidays, which I did forget to mention. Hospitals, you can't expect to be working holidays, and that also depends on the establishment and kind of what their norm is as to who they will schedule for what holidays. So I know there are places who will do, like, let's say you have 6 employees there working in ultrasound, and they'll say, let's say, all right, 3 of you this year will work this, and this holiday, and then the next year you will work this, and this holiday. Or they do it by seniority. So basically the ones who have been there longer will kind of pick which holidays they want to work and which they want to have off, and then they fill it in from there. Basically the norm is that you will probably want to expect to work holidays if you're working in a hospital, whereas in clinics you don't really see much of that, again depending on how the place is and how busy it is and how it runs. Now another difference that you could probably look at when deciding where you want to work is the kind of patient load you will have. And this also depends on the type of place you're working at and the business that they're raking in, basically. So in a hospital, obviously, you'll probably have more of a patient load. And depending on if it's just a freestanding ER or, like I mentioned before, a medical center where they have inpatients, outpatients, ER, peds, trauma centers, ICU, just depending on what kind of patients they'll bring in, that's where the difference in patient load may reside. Now in clinics, you'll have the option of having, these patients are scheduled by appointment. You might have time slots for each patient or each exam. So for example, I guess a patient would have an abdomen and that'll take like a good 45 minutes before the next patient is scheduled. Whereas a breast or a thyroid might take 15 to 20 minutes. But that kind of patient load can be organized in a certain manner, and you would expect to see more or less the same number of patients per day. Whereas at a hospital, it's kind of like the influx of business and how much patients come in. Now, when I worked at my full-time job, it was an endocrine place, so I was doing thyroids all day. Now, since it was the same thing, with the same amount of time roughly per patient, I was expecting to see a certain number of patients per day. Now for me, that was anywhere between 17 to 20 patients per day. Now something you can always expect more or less for both places are obviously when you have a stat, that's kind of priority and you get them done first. Now when it comes to stats in an outpatient place, those are obviously added in as emergencies. So even if you have your day set and your patients scheduled, there can always be potential for a stat to come in, and you would have to find a time or a slot to fit them in, especially depending on how the doctor wants you to see them. So it's kind of an expectation as to how many patients you will have, but there's always room for more patients to come in. So that's also something to consider. Now, types of patients and types of exams vary in the hospital. And obviously it varies by the need of the patient. So if you have a stat coming into the ER, where's my concealer? Now, if you have a stat coming into the ER, obviously the type of exam that you'll be performing will depend on what the patient needs. So it can be like a pelvic, an abdomen, a DVT study, just whatever the doctor orders based on the patient's symptoms and what the doctor wants to check out. And they may also have an ICU in the hospital, so you might expect to, I feel like it's kind of a little bit harder to talk while applying makeup, but I'm trying. You may expect to have to scan patients while they're intubated or just not conscious generally. Now the difference between a hospital and a clinic is that in a clinic, for the most part, patients are what we call walkie-talkies, which is basically they can walk, they can talk, they can take themselves to their appointment. You don't have to worry about transporting for the most part or anything of that nature as you would in a hospital where there's, admitted patients and patients in ICU and patients that overall just can't move or possibly communicate themselves. Now, types of exams for an outpatient setting. Again, depends on if the place is specialized. For example, the job I was just talking about, it was just all thyroids all day, every day. Or it could be an OBGYN where you'll be looking at babies, doing a lot of pelvics. Or it could just be an outpatient imaging center where they kind of look at all kinds of things. And it would basically be the same thing as a hospital, except time slots and all that. So if there's something that you know you have a strength in, or an area of study that you know you have a strength in, and you know that that's something that you want to specialize in, I would say get your registry in that, and then attempt to look for a job that really specializes in that, if that's something that you just want to really focus on in your career. If you don't mind and you just want to do general ultrasound, then it really depends on the type of workload and the type of, I guess, the type of life you want to live. If you want to live the being out all the time, being out at night, doing call versus just a regular 9 to 5. When I started clinicals, I really thought I was gonna want to do a clinic job and just have a 9 to 5 and all that. But over time, I started realizing that I really liked the hospital vibe and the atmosphere and the running around all the time. That's what I personally liked and still do to this day. So you never know, you might be surprised. So position types. Now hospitals, like I mentioned briefly earlier, have available positions of PRN is usually what you would expect to see starting out. Usually that's the position that they have most recent graduates starting out, or just new hires in general. That's usually what they offer, are PRN, on call, or per diem, depending on what they call them over there. And I feel like that's a good position to start out at, especially just out of school. They may offer or have full-time positions available, but depending on the establishment, they might reserve that for people who have been there longer, or people who just have more experience in general. Now, PRN is probably a good starting point for you because you're starting out and you're kind of getting used to the whole vibe of actually working in the field. Sorry, y'all, I took a break to go eat a burger because that's necessary. Like I was saying, PRN is probably the best starting point straight out of college, straight out of ultrasound school. And the reason I say that is because you're starting out, you're getting used to the hours, the vibe, the atmosphere of working in a hospital. And it's good because a hospital is generally bigger. There's most likely gonna be other ultrasound techs working there. People from all walks of life, people with different experiences, some more experienced than you maybe. And it's good to have a second set of eyes kind of looking at your images, something you might be confused about. Let's say you see some pathology in a patient that you've never seen before and you're not sure how to describe it. There's always gonna be someone there to help you out. On the other hand, in a clinic, it's probably gonna be just you. They're probably gonna offer you a full-time right then and there. But the difference is it's probably just gonna be you working there. Since if the establishment is small, they might just need just one person doing the job. So you won't necessarily always have somebody looking over your pictures. It might be just you and the doctor, or maybe just you. And if you see something that you really don't know about, it's a little bit more difficult and challenging to get a different perspective. That's why I say it's usually good to start out in a hospital or a bigger place with different people that can help you out, especially if they've been there a while. And I'm going to attempt something I've never ever done before, and that's gonna be that, you know, that brown eyeliner that like girls do on TikTok and stuff, that is like, it's like real subtle, but then it makes your eye kind of go like that. I want to do that. I have no idea how, but it never hurts to try. I've never done eyeliner before in general. I'm just kind of assuming this is how it's done. But anyways, one of the differences that you're probably thinking about the most when considering a job is the pay. Now, a hospital may pay you more to work for them, but like I said, if you're starting out in a PRN job, it's probably gonna be more pay but with less benefits. And I say that because you could be making the full-time hours or close to full-time hours, but you won't necessarily be full-time. That makes sense. So they kind of pay you more to compensate for that. And because if you're gonna be on call, the pay grade is different, because when you're not on call, you could be making a little bit less when you're not being called in. Whereas if you were to get called in, you would be making time and a half or maybe your regular rate. I completely failed on the like eyeliner thing, so I'm just gonna conceal it and move on. Now in a clinic, if you are working full-time, they may be able to offer you those benefits, but obviously it depends on the money they're making and what they're able to pay you. If it's a full-time, most likely you'll be able to get the health insurance and, you know, all the perks that you get for working full-time in America, I guess. So I feel like I kind of went a little heavy-handed with the dark colors, so I'm just gonna go with like a lighter nude on the inside. Now mind you, I know absolutely next to nothing about makeup. I just know kind of how to use it to not make me look more like an ogre or like a clown, but don't ask me the specifics on like makeup and stuff. I just kind of know when I go too heavy and when I don't. And I never do eyeshadow. That's one thing. I have a natural discoloration to my eyes that kind of make it look like I have eyeshadow on. I don't use eyeshadow. I just kind of have these because I used to use BoxyCharm back when I was big into makeup. Like I used to know about makeup, but don't ask me nothing about it no more. And I still have all this makeup from when I had BoxyCharm, and I decided to just whip them out for this video because why not? So another difference between these two establishments or types of jobs would probably be who you're reporting to when it comes to doctors and radiologists. Now in a hospital, there's most likely a team of doctors and radiologists that work for the hospital. And usually the hospital is going to have like these systems in place for how you're going to send over these reports or present it to them. So at least where I work, there's a PACS system in place where you kind of write in the report, you scan it in, and you send it along with the images you took to the radiologist. They'll dictate it, write their final report, and then they'll send it over to the doctor. That's how it is. And usually hospitals will follow a specific general protocol for that. But in a clinic, there's basically an individual or maybe a small group of doctors working together, possibly a radiologist as well, and they kind of have their own system in place depending on what works for them for how they're going to do these reports and send it over and diagnose the patients. Now in a clinic, usually the doctor is the one in charge. Now in a hospital as well, but there are higher ups that, you know, can also contribute to how things are done. But if a doctor is the owner of a clinic, usually you'll have to play by his rules, as in if he has a certain protocol he wants you to follow or a certain way that he wants you to do these exams. That's generally the rules you have to follow, as long as obviously it's not breaking any rules, as long as it's not something that you're uncomfortable with. Because if you're uncomfortable with the way an establishment runs things and they kind of want you to play into it, and you know in your gut that that's something that you're not supposed to be doing, I would just not do it. Speaking from personal experience, all right? So obviously you know best, but doctors should know better when it comes to what is and what isn't okay for how things should be done. Now, I kind of already talked about everything I needed to talk about, and I haven't even finished my makeup. So now what do? So I guess I'm just gonna go in and tell a story time. That was my original plan, was to tell this story time, but I felt like I didn't want to talk too much about ultrasound because see, I look white. Because my channel is not only focused on ultrasound, although that is what I have been talking about mostly. Dang, I'm white as crap. Anyways, I don't look as white on, maybe I just need a, I think changing the lighting might be good. All right, change in lighting. Don't be surprised. When I started my channel, I really wanted to just do ultrasound mostly, and then, you know, here and there also talk about hair and do my spiritual videos that I do over on my Facebook and TikTok. But for right now, I've been finding a whole bunch of content for now just on ultrasound because it's one of those topics that there isn't a lot of content for, and I want to be the type of person to really help out where it's needed. I'm not the type of person who will just jump on a trend or jump on a hype just because it'll get them the most views. So I guess what I'm gonna do is kind of go into this story time about the crazy call shift I had 2 nights ago. Now when I had my issue on this video that I was gonna put out, I had a completely different setup. I had my makeup done and I kind of had everything in order on how I was gonna do it, and I did it, and then half of the film deleted. Would you look at that? So when I was trying to figure out what I was gonna do concerning that, if I was just gonna put out half the video or if I was gonna redo it or if I was just gonna do something else, it was already Friday by that point. And I really wanted to stick to my Friday schedule. So I was kind of a little bit worried because I still wanted to get a video out. I really wanted to stick to my Friday routine because I know when I started this channel, I wasn't really following my schedule. And that's mainly because of the whole full-time job and not really sticking to my schedule, not finding the time to dedicate to my content. So I said 2022, that's what I'm gonna do. That rhymed. So I really wanted to get a video out for Friday. I was like, this has to be a kind of short video, something easy for me to edit at work, because also on Friday I worked 11 to 11 at my hospital job. So I was like, it's got to be something that I can edit real quick on my phone and just get it out. Even though I'm not the type of person to just do minimal effort to mediocre when it comes to my content, but it was something I was gonna have to do for now. So I posted a poll on my story on Instagram and I asked if anybody wanted either a get ready with me video or a story time. Now, at first it was leaning more towards story time. So I was like, dang, what about my life is interesting that I can talk about? And I was talking to my boyfriend and he mentioned the one crazy night I had 2 nights ago. Now, he knew about it because I was talking on the phone with him at 2 a.m. after that night. And he's very supportive of me. And, you know, when I'm going through something, he's always the first one I call for like advice and stuff. And so naturally, I called him at 2 a.m. Well, actually, it was like 1 something a.m. to kind of tell him everything that was going on. Not to mention the fact that I was lost. I was lost on a street I didn't really recognize. And I called him and kind of told him about everything that was happening. So when I called to ask what kind of story time he thinks I should do, he told me this one. So I was like, okay, probably a good idea because it was a crazy, crazy night, let me tell you. So I guess I'll get started instead of yip-yapping. So before I actually started call on this day, I was only supposed to be on call for 1 hospital. This hospital that I work for has 2 freestanding EDs, so I was only supposed to be on call for 1 of the EDs. And they had a crisis over at the other ED, so I accepted call at the other ED as well, thinking maybe they're not that busy at both EDs, so I can definitely do both. Boy, was I wrong. So at both of the hospitals, I was doing 8 p.m. to 8 a.m. call. And as soon as it was like 8:11, they called me from one of them because apparently they didn't have my number saved and they were trying to call somebody else. And the other person, turns out they weren't on call, obviously, because I was on call. And then they called me. And they were, I guess, trying to figure out the whole scheduling thing. So I went to go call them back and then the other hospital called me. And they were saying that I had a pregnancy to do over at that ER. And it was a second trimester. It wasn't like it was a first try. So I was like, okay, I kind of have to worry about this hospital that called me first because, you know, first come, first serve. That's how call works. And the first hospital told me, oh, by the way, we might have 2 more stats coming in by the time you get here. So I would have to do a total of 3 ultrasounds before I go over to the other hospital. I was like, okay, well, the other hospital called me, so I'm not sure if I'm supposed to do the 3 there and just have the other hospital wait, or do the one that was already ready, go to the other hospital, do that one, and then come back. I didn't know what to do. I called the lead tech and she said if they already have the other pending ultrasounds, then call the other hospital and see if maybe that patient has labs to do or something. And then, you know, just have them wait a little bit. So I did that. I only ended up having to do 2 ultrasounds at that hospital. Then I had to drive the 15 minutes over to hospital number 2. At this point, it was already nearing 11 o'clock and the patient had already been waiting 2 hours for me. So I get there and I'm like, okay, I'm ready to do this second try ultrasound. And when I look at the orders for this patient, it's like 3 ultrasounds for the same patient. And I'm like, what is it that they're looking at? And they had ordered a second try, a abdomen complete, and a transvaginal on her. Not sure why. And I'm going to be trying to tell all of this info without, you know, breaching HIPAA or any kind of personal information on the hospital or the patient. So basically when I get there, I'm kind of asking the doctor, like, what is it that, you know, is needed on her? And that she was saying, I guess she was trying to find out if she had appendicitis. And the other tech before me had tried to look for an appendix, but I guess the images were non-diagnostic. So they just kind of like scrapped that whole thing. And then she also mentioned to me that the patient has 3 kidneys. the patient was worried about whether one of the kidneys were acting up or whatever. So she was like, I just really want to look at the kidneys. And I'm like, okay. You can order an abdomen limited to see if I could probably see appendix and kidneys, or a renal. So she ordered a renal. Now I get there and I check on baby first. That's my first priority. Check on baby. Baby's good. So I'm like, okay, I'm going to check on your kidneys. And it turns out her right side was bothering her more than her left side. And I was like, so which side is it? I was just curious. I was like, so which side is it that you have 2 kidneys in? And she's like, oh, I don't remember. I just know that I have 3 kidneys. I was like, cool. So now I'm on the hunt to find the 3rd kidney. Now, according to protocol, and because her right side was bothering her, I started with her right side. And it was her right side, had a little bit of hydro. Really hypervascular, the works. So I do her right side, and then I'm like, okay. Then I do her left side. And her left side is the side that has the 2 kidneys. Now, I've realized that it's actually a duplicated collecting system. It was like 2 kidneys kind of like merged into one. It was really interesting to look at. Like, you see it in textbooks, but to see it in real life, that's really cool. So I see it. Duplicated collecting system. Measure both. Try to see if there's any hydro. There was a little bit, but not, not as much as right side. And mind you, this hospital that I went to hospital number 2, I'd never been there before. I'd never worked there before. I don't know their PAC system. I don't know, everything. Well, I do know their PAC system because I work for the same company, but I didn't have access to it. So, I had to ask for help and all that. So by the time I really left the house, it was nearing 1:15 in the morning. And mind you, I had started the whole job at 8 p.m. So it was interesting for me, but at the same time, I was like real tired. And then also the next day, I had to start work at 11 a.m. That's the life of a PRN. I don't know if I want to do like a pink look or if I want to do like, I already did like nude, I guess. I don't know if I want to add pink on there because like I'm going to be changing my clothes, but I'm also probably going to wear pink again. I don't know. So then after I'm doing all that, oh, and I also had to do the transvaginal on her. That's the part I forgot. So transvaginal on already a 2nd trimester. I didn't think I was going to see much, but they wanted me to try to see ovaries because the last tech had said that they saw ovaries and had good flow, but they didn't document it. So I had to go back in and see. Now for me, in transvaginal in general, ovaries are pretty difficult for me. They've always been ever since clinicals. And I can find them. It's just going to take me a little bit. So I'm trying to find ovaries on this patient. And the doctor comes in and she's like, I'm wondering if you can see her appendix through transvaginal. And I'm like, I can barely see ovaries because I wasn't seeing anything. She was like, okay, fair enough. At least you tried. So I think the most conclusive results I got were of her kidneys and that baby was okay. Now about appendix, I really don't believe she had appendicitis, but that's for them to, you never know what happens to an ER patient after they leave the ER. So I guess they were just more focused on her kidneys than really anything else. So once I leave, like I said, it was nearing 1:15. I was tired. I wanted to go home and sleep. I put on my GPS because obviously I've never been to this hospital before. And it was going to be a 30-minute drive from the hospital to my house. So the GPS takes me on the street and I see all these cars backed up. And then I also see like the red lights of the, I was nearing a railroad crossing. And I see the lights, and I'm like, okay, so a train's coming. And I'm approaching. I'm still pretty far and I could still see the lights. And I'm approaching and the lights are still going, but I don't see a train passing. And I'm like, is this train gonna pass by the time I get here? And when I get there, I realize the train is just stopped right there in front of the cars on the railroad crossing and it was not moving. I was like, did it malfunction or they're doing maintenance? I didn't know what was going on. And I sat there. See, this is my problem, is that I'm a patient person, especially when it comes to driving. So I was like, okay, I'll just wait here until they finish what they got going on. And a good like 5 to 10 minutes passed. And then I see the car in front of me, kind of in front of me, like to the side. They back out, they make a U-turn, they dip. And I was like, maybe I should do that too. But me being me, I waited a good 2 more minutes and then I did the same thing. Backed up, U-turned, dipped. By the way, this is like the makeup look I do for all of my videos, minus the eyeshadow. I don't know where I pulled this from, but this is more or less what I do. So when I dip, I'm hoping that the GPS is gonna, point me somewhere else. But it kept trying to push me to do a U-turn or do a series of turns, which is just going to take me right back to the road. And I'm like, no, I'm not trying to go on this road. It kept trying to do that. So what I did, the GPS was stubborn, but I was stubborn because I'm not going back to that road. Are you kidding me? So I just kind of kept driving until the GPS finally took me to a street that I more or less knew how to navigate. And I'm like, if you had took me here the first time, we wouldn't have this issue. But before that happened, I texted my boyfriend and asked him if he was up. And then he called me. And at that time, I was already kind of frustrated and tired. And I'm like, I don't know what's going on. I'm lost. I'm like, this and this and this happened. I don't know what's going on. And I'm lost. And it's 1 a.m. and I'm lost. Like, I think I told him I was lost like 3 times. And he was like, all right, calm down. You know, like, just keep driving and see what the GPS gives you. I was like, you're right. I need to chill out. So I chilled out. And then ended up taking me, you know, to the street that I knew. And then I made it the rest of the way home. And it was almost like 2 a.m. at that point. And then I'm over here, you know, getting undressed and stuff, about to go into bed, and they call me again. The CT tech calls me, and he's saying that the radiologist kicked back my study because I was missing the computer page with all the study data. And I'm like, I printed the page without the study data. So it's like, you know, when you're like, you know, when you do an OB ultrasound and you're doing the measurements, and then at the end you kind of print out the worksheet that has all that information. I did that. And I guess it didn't go through or whatever. And I'm like, even if it didn't go through, you have it. I wrote the report down. I even wrote it on a sheet of paper. The worksheet that I wrote down has the same measurements that it would have had on that page. So it's like, you have it anyway. So I can't talk while doing this. So I'm like, you have that information anyway. And I don't know, the radiologist he refused to read the report unless I had that, you know, settled. And it's gonna be my finished look. Not sure though. So I was like, I don't know what to do. And the CT tech is like, well, either maybe you can call the lead tech and see if she can fix it, or you might have to come back here just to, I guess, see how you can fix it. In my head, I'm like, why am I gonna drive the 30 minutes back to print out a page that technically the radiologist already has? And so I'm like, okay, I couldn't walk the CT tech through it. I mean, I didn't think I could. I was like, I didn't think to do it. And so I was like, okay, I'll just make my way back just in case there's anything else that they need help with, and I'll just do it and then come back home. I'm on my way there already, and I had already tried to call the lead tech. She was working that night, and I think she was like doing a study. And so she called me back when I was on my way there, and she's like, what's going on? And I'm telling her what's going on. And I'm like, so I did this study and I printed the, you know, the study data at the end, but it's not going through for some reason. And she's like, yeah, I'm seeing it. I'm trying to push it through and it's not pushing through. But she was like, I don't know why they're, you know, I don't know why they're pushing for it, but I'll try to push it through. And then it was giving her an error to push it through. And then she finally got it. So she was like, just go ahead and go home. Like, I got this. And I was like, you a real one. You a real one for that. And so I went home and I went to sleep. And it was kind of crazy. At that point, it was like 2:30 a.m. And I woke up at like 9 to get ready for work at 11. So that's the end of my story time. This is the finished look. Let me know in the comments if you want to see more of this, kind of getting ready and talking about what I'm talking about, or if you just want me to just be already one and done and talking about what I'm going to be talking about. I'm going to try to get more content in about curly hair. As you can see, my hair is not even done. And my spiritual content that I do have some ideas for. And I'm just trying to get that, you know, in there. So I hope you guys enjoyed this video. It's obviously, you know, it's something new, something that we're not all used to. And as you can see, I didn't time out my content with the time it was going to take for me to do my face. So luckily I had something else to fill in the time. Comment down below if this is something that you want to see more of, or if you want to, you know, see me back doing just talking, straight talking and giving the facts. I just wanted to kind of make it fun, I guess. And yeah, like, comment, subscribe, do all that good stuff. And I'll see you next time. Bye.